There's a moment that many people over 60 know very well. You're getting up from a chair, maybe after lunch, maybe after spending some time watching TV, and the exact moment your weight shifts onto your knee, there it is, that feeling. It's not just pain, it's friction, a deep pressure, as if something inside is scraping. And your doctor has already told you what it is: bone on bone. The cushion that used to sit between the bones has worn down over time, and now every step, every staircase, every simple movement of daily life comes with a reminder that something has changed. Maybe you've already stopped taking your morning walk around the block because of it, or you avoid sitting on the floor with your grandchildren because you know getting back up will be hard. Or maybe you simply woke up one day and realized you were planning your movements, choosing where to sit, calculating how many steps there are before entering a place, because your knee now demands that kind of attention. I understand. And as a physical therapist with over 10 years of clinical experience, I can tell you one thing with confidence. Bone on bone does not mean you have to stop. It means your knee needs a specific kind of care. And that is exactly what we're going to do today. In this video, I'm going to show you 6 exercises from number 6 all the way to number 1, the most important one of all. Each one has a clear clinical purpose, and together they form the foundation of what I prescribe to patients with this diagnosis. Stay until the end, because before we finish, I'm going to show you one movement you do several times a day. And it may be overloading your knee without you even realizing it. I like to explain to my patients what is happening in their body instead of just throwing exercises at them and saying, "Do this." You may not know this, but the knee is a joint that depends on 2 things to work well: cushioning and stability. The cushioning comes from cartilage, that smooth layer between the bones that allows movement without friction. When that cartilage wears down, the bones begin to have more direct contact. That is what bone on bone means. But here's what most people don't know. Cartilage is not the knee's only shock absorber. The muscles around it, especially the quadriceps at the front of the thigh and the glutes in the back, work like a suspension system. When they are strong, they absorb part of the impact with every step, every movement, every time you get up from a chair. When they are weak, all that impact goes straight into the joint. And science confirms this. A Mayo Clinic study followed 265 people with knee osteoarthritis over 30 months and concluded that quadriceps strength directly influences cartilage loss and the progression of pain. In other words, strong muscles are not just about comfort. They are real protection for the joint. And there's a cycle I see in the clinic all the time. Pain shows up. The person starts moving less to avoid the pain. The muscles get weaker. The knee has less support, and the pain gets worse. It's a silent trap, and that is exactly the cycle we're going to interrupt today. Before we begin, let's make one thing clear. Some mild muscle discomfort may happen, especially the first few times. That's normal. What should not happen is sharp pain inside the knee during the exercise. If that happens, stop, rest, and try the easier version I'll show for each movement. Tell me in the comments. Do you feel more knee pain when you're moving or when you stay still for too long? And where are you watching from? I answer all the comments, and I love getting to know you better. But enough talking. Let's get to what matters. What you can start doing today to improve your knee. Exercise 5, heel slide. Let's start on the floor, or on your bed if that's easier for you. Lie on your back with both legs extended and your body relaxed. The heel slide is the first exercise for one very specific reason for anyone with bone-on-bone knees. When the cartilage is compromised, the knee tends to gradually lose range of motion, not because of the joint itself, but because the tissues around it stiffen up to protect the area. This movement gently reintroduces sliding, without weight-bearing, without impact. It's like reminding your knee that it can still move. Here's how to do it. With your heel resting on the floor or on the bed, slowly slide your foot toward your hip, bending your knee as far as you can without sharp pain. You don't need to go far. What matters is that the movement is controlled and progressive. When you reach your limit, hold for 2 seconds, then slide back until your leg is fully extended. One thing I notice a lot: People rush the return. They go slowly on the way in, then let the leg drop quickly on the way back. But it's exactly on the way back, as the leg returns to extension, that the muscle really does the work. Control the movement all the way to the end. Another thing, don't press your heel hard into the surface, trying to create friction to help the movement. The slide should be light. If it feels too stuck, wearing a thin sock or placing a plastic bag under your heel can make the movement easier. Do 10 repetitions on each leg at your own pace. Now let's move on to number 4. This one is less well known, but for knees with advanced wear and tear, it may be the most important of all 6. Exercise 4. Pressing a towel under the knee. Stay lying on your back. Now take a folded towel, a foam roller, or a small pillow, and place it under your knee, leaving it slightly elevated with the leg relaxed over the support. This exercise has an ugly name in English, quad set, but what it does is simple and extremely important for your specific situation. When the knee has advanced degeneration, the quadriceps, the muscle at the front of the thigh, starts to shut down. Not because it's lazy, because it's protecting you. The nervous system senses pain and begins to inhibit muscle contraction to avoid putting more stress on the joint. The problem is that without this muscle activated, the knee becomes even more unprotected. This exercise breaks that cycle. Here's how to do it. With your knee resting on the towel, tighten the front of your thigh, as if you were trying to push your knee down into the support, flattening the back of the knee against the towel. Your heel will lift slightly off the floor, but your foot doesn't move. Hold that contraction for 5 seconds, breathe normally while holding it, then release slowly. What often happens is that people try to help the movement with the hip or the abs. They lift the hip, twist the body, and tense up everywhere except where they actually need to. If you're not feeling the front of your thigh working, the muscle is not being properly recruited. Place your hand on the front of your thigh and make sure it firms up during the contraction. Do 10 repetitions on each leg, 5 seconds of contraction, then a controlled release. This is the quietest exercise on the list, but for a bone-on-bone knee, it's one of the most strategic. Now let's move on to number 3. Exercise 3. Bridge. This is one of the most well-known exercises in physical therapy. Still lying on your back, bend both knees, keeping your feet flat on the floor, hip width apart. Arms by your sides, palms facing down. I know what you may be thinking. What does the glute have to do with my knee? More than it seems. The gluteus maximus is the most powerful muscle in the body, and one of its main jobs is to control how much load goes into your knee with every step, every time you climb stairs, every time you get up from a chair. When it's weak, the knee takes on that job by itself. In a healthy knee, that's already a problem. In a bone-on-bone knee, it's what turns simple movements into sources of pain. Here's how to do it. Press your feet into the floor and slowly lift your hips, one vertebra at a time, until you form a straight line from your knees to your hips to your shoulders. At the top, squeeze your glutes intentionally. Don't just lift your hips, actually contract the muscle. Hold for 2 seconds, then lower back down with the same control without letting your hips drop all at once. There's one detail that changes everything in this exercise: the position of your knees. If they open out to the sides as you lift, your gluteus medius is trying to compensate for what your gluteus maximus is not doing. Keep your knees pointing forward, aligned with your second toe, throughout the entire movement. The easier version, if you feel discomfort, is to reduce the range of motion. Lift only as high as your glutes can contract without your knee complaining. Over time, your range will naturally improve. Do 12 repetitions, 2 sets if you're feeling good. The next exercise changes position and works on something most people with bone-on-bone knees avoid without even realizing it. Exercise 2, seated pillow squeeze. Now sit in a chair with a backrest, preferably a firm chair, not a deep sofa. Sit right in the center of the seat with both feet flat on the floor and your knees bent at 90 degrees. Take a pillow, a soft ball, or even a thick rolled-up towel, and place it between your knees. This exercise works the adductors, the inner thigh muscles. But the clinical goal here goes beyond that. There's a small but very important area on the inner side of the knee called the VMO, the vastus medialis oblique. It's the part of the quadriceps that stabilizes the knee from the inside, helps prevent the kneecap from sliding out of place, and in people with joint degeneration, it's often the first to weaken. When the VMO is inactive, the knee loses internal stability, and that shows up as pain, a feeling of instability, and more wear over time. Here's how to do it. With the pillow between your knees, press both knees toward each other as if you were trying to crush the pillow, without moving your feet off the floor and without leaning your torso forward. The contraction should happen in the inner thigh, and you should feel the muscle above and slightly to the inside of the knee working. Hold for 5 seconds, then release with control. What I often see is people contracting everything, their abs, jaw, shoulders, except the right area. Breathe normally during the contraction and focus your attention on the inner thigh. If you place your fingers slightly above the inside of your knee, you'll be able to feel the muscle firming up when the contraction is correct. Do 10 repetitions, 5 seconds each. Now let's move on to number 1, where the knee begins to work through a real-life range of motion. Exercise 1, seated knee extension. Stay in the same chair, same posture, back supported, feet on the floor, knees at 90 degrees. I saved this one for last on purpose. In the previous exercises, you were building something, activating muscles that had gone dormant, creating tension without movement, preparing the knee for what comes now. This exercise is where all of that connects. And it is also the movement that scares people with bone-on-bone knees the most, because it involves moving the knee through a real range of motion, with load, without support. But that is exactly why it is the most important one. Think about what happens when you get up from a chair, when you go down the stairs, when your body has to slow itself against gravity. The quadriceps is always there, controlling the movement, absorbing impact, protecting the joint. When it is strong, the knee has support. When it is weak, the bone carries by itself what the muscle should be carrying. Here's how to do it. With your right foot resting on the floor, slowly lift your leg until it is extended and parallel to the floor. At the top, tighten your quadriceps with intention. Don't just hold your leg in the air. Consciously contract the muscle at the front of your thigh as if you were trying to lock the knee. Hold that contraction for 3 seconds. Then lower the leg, and here is the heart of the exercise, over 4 full seconds. Count it. 1, 2, 3, 4. Your foot touches the floor with control, not with a drop. That slow lowering is what we call eccentric work in physical therapy. It is the type of muscle contraction that best protects a worn-down joint because it trains the muscle to slow the movement down, which is exactly what you need in daily life. It is not the lifting that hurts a bone-on-bone knee. It is not being able to control the lowering. If you feel discomfort behind the knee when fully extending it, back off 1 or 2 degrees. Go only as far as your knee allows without sharp pain. That is not limitation. That is intelligence. Do 3 sets of 8 repetitions on each leg. Rest 1 minute between sets. And if, by the 3rd set, the lowering is no longer controlled, stop. A fatigued muscle does not protect a joint. Now that you've learned all these exercises, you've activated the quadriceps, worked the glutes, and created stability around the knee. But there is one moment that happens several times a day in your life that may be undoing part of this work. And you do it without realizing it, because you have always done it this way. It is the way you sit down and the way you stand up. When someone with a healthy knee sits down, the body naturally distributes weight between the joints. But when there is joint degeneration, the way you start that movement changes everything. Most people with bone-on-bone knees do one very specific thing. They throw their weight forward, let the knees move too far past the toes, and use momentum from the torso to stand up, instead of using the muscles. It is easier, and it may hurt less in the moment, but over time, this strategy increases pressure on the joint surface exactly where the wear and tear is already happening. The change does not have to be dramatic. Start like this. Before standing up, Slide your body to the edge of the chair. Place your feet slightly farther back than usual, one foot slightly in front of the other if that helps. Lean your torso forward from the hips. Don't round your back, tilt the whole body. Then push the floor away with your feet, activating your thigh and glute muscles to rise. The knee moves, but it does not lead the movement. The hip leads. To sit down, the process is the opposite, and this is where most people make the biggest mistake. Don't drop into the chair. Control the descent with your muscles, exactly like you trained in the previous exercise. Lightly touch the chair before relaxing the muscle. It sounds simple, and it is. But when you do this consciously, you are applying outside the exercise session what you trained during it. And that is where improvement really happens. Not during the exercises themselves, but in the small daily movements you repeat dozens of times without thinking. As for how often to include these exercises in your routine, the ideal is at least 3 days a week. But let me be honest with you about one thing. The first time you do these exercises, they will probably feel like very little. You may finish and think, "That's it?" And the answer is yes, that's it. Because the goal of this first week is not to exhaust you. It is to reconnect. Your nervous system needs to relearn how to recruit muscles that were pushed into the background because of pain. That does not happen through force. It happens through calm, consistent repetition. By the second week, you may already notice a difference, not necessarily in the knee itself, but in the quality of your movement. The lowering will be more controlled. The contraction will be easier to find. The body starts to remember. And at some point, maybe in the third week, maybe in the fourth, you will do something during your day and only afterward realize that your knee did not get in the way. That moment is small, and it is everything. If your pain is getting worse over time, if your knee swells frequently, if you feel instability, that sensation that the knee could give way at any moment, or if, during these exercises, the pain was sharp and persistent, these are signs that you need an in-person evaluation. A doctor or physical therapist needs to examine your knee closely before you continue. Not because exercise is wrong, but because the right exercise depends on what is happening specifically with you. That said, if you made it this far, you have already done something many people with this diagnosis do not do. You did not stop. You looked for information, you tried to understand what is happening in your body, and that is already the beginning of real change. I left 2 options in the pinned comment for anyone who wants to continue this work with more structure. The first is a complete step-by-step exercise program for you to follow at home at your own pace. The second is a natural supplement developed specifically for joint health and to help reduce inflammation. The links are there if you want to take a look. And tell me in the comments, do you already know which exercises you're going to start today? If you want to keep taking care of your body with simple, safe exercises designed for real life after 60, subscribe to the channel. See you in the next video.